Welcome to the HealthiHer podcast. Your host, Dr. Amy Brenner, is a board-certified OBGYN with additional certifications in functional and integrative medicine. This podcast is meant to help women find reliable, relevant information to help them feel better, look better, and live better. Here you will hear in-depth information about hormones, sexual medicine, aesthetics, cosmetic gynecology, and functional medicine.
Well, welcome back to another episode of HealthiHer. If you have entered the perimenopause phase, I'm almost certain that you're going to want to stay tuned for this episode on best practices on improving your sleep during perimenopause. For those of you that know me, I'm 52, and this is probably the thing that plagues me the most. So I'm really excited to hear what our guest has to say. So we have a special guest. Her name is Dr. Val Cacho, and she is a specialist in sleep issues in the perimenopause. So welcome, Dr. Cacho.
Thank you so much, Dr. Brenner. Very happy to be here.
So tell us about yourself and how did you end up becoming a specialist in sleep in the perimenopause area?
Yeah, great question. So a little bit of background about me. I'm a medical doctor. I'm trained in internal medicine. And then I went into a year-long sleep fellowship program. And then I also did an online program in integrative medicine through Dr. Andrew Weil's program, University of Arizona. I moved from California, where I'm originally born and raised, to Hawaii about 7 years ago. And I really set about practice there, working with a hospital. And a lot of the people who would come to see me with difficulty sleep were generally women. A lot of primary care physicians aren't too familiar, aside from giving people sleeping pills, of how to help women sleep. And so over the years, I've really just honed in on that. There's a lot of gender bias within medicine, especially around sleep. A lot of the sleep apnea studies are in male, but as women go through menopause, I'm sure we'll talk about this later, there's a lot of different changes. And so, really focusing on treating women who have a hard time sleeping has been my mission for the last several years.
I'd love for you. I think everybody knows that when they don't sleep good, they just don't feel good. And you just struggle for a lot of things. But I'd love for you to elaborate, other than just not feeling good and being tired, of what are some of the other reasons of why quality sleep is so important to our health?
Oh, that's a good question. It's like, almost, where do we start?
So I know, right?
Like a top-down approach.
Talk for an hour just on that.
Yeah. So I'm starting from the head down. Sleep is really important for our bodies to rest. Our brains are actually still pretty active when we sleep. There's different processes that happen. One of the biggest is something called the lymphatic system, which is basically like the trash collector for our brain. Throughout the day, there's toxins that are built up. And when we sleep, especially when we get our deep sleep, the junk from the day is cleaned out. And so if we don't get adequate amount of sleep, if we have disrupted sleep for, whatever reason, then our brains actually don't work as well. So I like to really focus on the cognitive concerns, so problems with memory. I'm sure that's something concerning for your audience as we get older, our memory concerns, brain fog, being able to focus, and mood is definitely a big one if we're talking about, the overall brain health. And then going further down, right, our heart, what's going on with our cardiovascular system if we're not getting an adequate amount of sleep, whether it be from undiagnosed medical sleep conditions or maybe purposefully or not intentionally depriving ourselves from sleep. Sleeping less than 6 hours has been associated with increased risk for cardiovascular disease, higher blood pressure rates. What else? We talk about our metabolism. There's basically hormones that affect our appetite and our satiety, ghrelin and leptin. So ghrelin, I always think of like a gremlin, makes you want to eat more. And they have done studies, night shift workers, like the Nurses Health Study, and they also took a look at college age students. And when they don't get enough sleep, what happens? Well, they tend to crave more fast fuel, which I like to call simple carbohydrates, junk food, right? Because that quick fiber gives us more energy. But really, it's your body telling you that you need to get more rest, because that ghrelin goes up, makes you want to eat more, and then leptin goes down. So we talked about our brains, our hearts, our cardiovascular system. What else that we can talk about in
What
terms of
about even
sleep?
cancer? Can it increase your risk of
Cancer.
cancer?
Oh, yeah, definitely. And that's sort of, really interesting for, we know the data in night shift workers again. So like the Nurses Health Study took a look at overnight workers. What happens when you don't get enough sleep? There's higher incidence of breast cancer. And why is that? I still think we're looking at the data, but we do know that women, if you had an initial episode of breast cancer and you actually take melatonin. So melatonin is a natural hormone that's released in darkness and helps us sleep. It may actually have some anti-cancer properties to it, because there's a decreased incidence of the second event for women who do take some melatonin. So yeah, it's really interesting. Yeah, there is increased cancer risk as well from not getting enough sleep.
Yeah. So this is really so important. How did this become your area of interest?
Yeah, so I grew up in a family of physicians. My father's actually a cardiologist, and I knew pretty early on I didn't want to be a cardiologist given the amount of work that he provides. He's an interventionalist, so leaving for the hospital in the wee hours of the morning. And then one of his good friends actually is a sleep physician. So I heard him give a lecture about it. It was probably maybe high school or college. And the first I found out that sleep was actually its own specialty. So throughout medical school, I followed some sleep doctors, and then residency. I did a month training in it as well. And so I just really dived down into it. And it works well for me because I like to take an integrative approach. I'm really interested in preventive medicine, lifestyle medicine. How can we reduce our risk for cardiovascular disease, for Alzheimer's, for dementia, for cancer, right? And when you take a look at it, sleep is so foundational. It's one of our pillars of health. For a long time, we focused, just in our culture, on diet and exercise. And those are fantastic things really to focus on. However, I like to offer that if you don't get enough sleep, guess what? It's so easy to drive through the drive-through and just pick up some fast food, because if you don't have enough energy, think of all the energy it takes to decide how to cook a healthy meal, go to the grocery store, go home, cook it, and then clean up after yourself, versus, all right, I didn't get enough sleep, I'm stressed out for my job, got family to take care of, let me just go through the drive-through and have a quick meal. So I think sleep makes you make better decisions in around your health, and that's the diet aspect. And guess what? If you have more energy from sleeping more, you're going to want to go to the gym, right? You're going to want to move your body. Sleep gives you that, makes it easier
Yeah.
to be healthier.
I couldn't agree more. In our practice, we do a lot of hormone stuff, and we ask people about sleep. And I say, like, we can balance your thyroid, replace your sex steroids or your menopausal hormones, like, till the cows come home. But if you're not sleeping good, it's going to be difficult to make you feel good.
Right. Yeah.
So why is this such a common reason? I guess this is a two-part question. Why is it more common with women, and why does it happen as we age?
Yeah, that's a really, really great question, a loaded question. So we can take a multi-pronged approach. And I recently looked at a research article about it that talked about 8 different factors why women through the perimenopause, menopause transition have difficulty with sleep. So if you start with just from what happens as women go through menopause, right? I'm sure you can speak more to this than I about the fluctuations in estrogen and progesterone levels, right? So progesterone is also known as a relaxation hormone. And so sometimes when that decreases, that can result in difficulties with sleep. Some of the research studies are really interesting around this, where they've actually done subjective surveys of women's quality of sleep as they're going through perimenopause. And what they found is that the rate of change of FSH, so the follicle stimulating hormone, has been associated with poor sleep. And then in other research studies, they've actually put women who've had, fluctuating levels of hormones, specifically high FSH levels, in the lab. So talking about the sleep lab, and actually measuring their brain waves, measuring the quality of sleep that they have from an objective standpoint. And it doesn't always come out to be the same. So our subjective experience doesn't always relate to what researchers see in the lab. So that's one thing. And I think another thing too is, as you know, women have higher rates of mental health conditions, right? Anxiety, depression. And, really how I describe sleep to a lot of my patients is, well, sleep happens when your brain waves slow down, your muscles relax, and you lose consciousness. So, if you have a lot of anxiety for whatever reason, hormone fluctuations, bodily changes, work stress, family stress, that can actually keep you from falling asleep. And then when you don't have enough sleep, right, all that gunk from the days and getting cleaned out. So your emotions can be running high. One of the things that we learn in sleep fellowship is mood is one of the first things to go if you don't get enough sleep, right? So we talked about some of the hormone fluctuations. We talked about how stress can play a role. And what about aging? Aging in and of itself, right? As we know, it's associated with medical health problems, higher rates of arthritis, just the wear and tear of our bones, just feeling uncomfortable, not being able to sleep on your back anymore because the muscles of your upper airway are narrowing and collapsing. Your tongue is falling you back, waking you up, which is called obstructive sleep apnea, which is something that we see more oftentimes as women go through menopause because of hormone fluctuations, because of weight distribution issues where, we tend to gain more weight. Maybe it's an issue of our metabolism slowing down, but also maybe it's an issue of, stress keeping you from sleeping and then not having enough energy to eat healthy food. And then you're gaining weight and then you're getting sleep apnea. So it's like the cycle can be repeating itself. So yeah, having rates of underlying medical sleep conditions, obstructive sleep apnea is one of them. If you take a look at the premenopausal women to the postmenopausal women, some of the research shows that rates are 2 to 3 times higher. So obstructive sleep apnea is still something that's really underdiagnosed in general population, but even more so in women.
Yeah, it's like this chicken or the egg or this snowball rolling downhill of mood issues can make you not sleep, but not sleeping can give you mood issues. And being overweight can make you have sleep issues and sleep apnea. And, but not sleeping can make you overweight that leads to sleep apnea.
Right. And then we haven't even talked about hot flashes yet.
Yeah.
And so the hot flashes and the night sweats, right, can add to the milieu of why women have a hard time sleeping during menopause. But, I think with all that is said is that there's great people out there like yourself that are talking about women's health issues, that are bringing up the conversations and really giving people hope that there are solutions. I don't know if you've ever been on any of these sort of message boards on social media where there's a lot of despair out there. I read one research article recently that talked about how 10 years women can have difficulty with their sleep before a doctor will actually order them a sleep apnea test to see if that's the cause. Because oftentimes they get told that, oh, you're just having anxiety and that's why, you're not sleeping, go try this, antidepressant, or maybe it's your thyroid issue and that's why you're having difficulty sleeping. So, there is a lot of gender bias in medicine. And then, when I was a medical student a little over 10 years ago, I only had 1, maybe 2 lectures about sleep. And so it's really not emphasized enough.
Yeah, because most, at least around where I live, I would say the majority of people in the perimenopause are taking a prescription medication like trazodone, Ambien, Lunesta, something like that. What are your thoughts on those kinds of sleep aids? I have yet to meet anybody, or even myself when I have taken those in the past. When you take them chronically, I've yet to know anybody that says, "Oh, I feel great."
Right. Yeah, and that's such a good question. I'd say as a whole, most sleep doctors don't prescribe sleeping pills. And the reason for that is we like to look for, why is someone having a difficulty time sleeping? Typically, right, stress, anxiety, untreated medical sleep conditions like restless leg syndrome, obstructive sleep apnea. So I like to think of sleeping pills just like I think of pain medications, right? They are helpful, they're beneficial in the short term, but in the long term, are we really doing our patients any benefit by allowing them to continue on them? There is the recommended treatment for insomnia, which is cognitive behavioral therapy. And that's something that the American College of Physicians, the American Academy of Sleep Physicians also really recommend. The problem with that is there's lack of access to behavioral sleep therapists. And not a lot of sleep doctors take the time or are trained to do good cognitive behavioral therapy. So, taking sleeping pills, what they do, oftentimes they work on the GABA system. So Ambien, Lunesta, the Z medications, or the benzos really can help someone by slowing down your brain waves. But if we're on them chronically, even some research shows, I think up to 16 times a year has been associated with memory concerns. Women, if you take a look at the FDA approval for these medications, Ambien or Zolpidem, the generic form, was the first gender recommendation where, 10 milligrams for men, 5 milligrams starting dose for women. The way we metabolize this drug is a little bit different. Yeah, so those are some things to keep in mind.
So memory issues in the short run, like, oh, I don't remember going to bed last night, or more memory issues like dementia and that kind of thing?
I would say both, right? Because if it puts you into a deeper sleep, you may have some amnesia. One of the side effects, and it's why the FDA changed the dosage, is for complex sleep behaviors. So I don't know if you've heard these stories, but I had a patient recently tell me that she got in her car, drove down to the local 7-Eleven, got an energy drink, and came back home and had no recollection for it. Right? It's pretty scary. Some people, are just
a lot of
texting
sleep
or
eating,
doing emails.
waking up
sleep
and eating.
Exactly. Yep. Sleep eating. Not everybody has them, but it is very concerning. And then yes, for chronic people who are on it for, I guess say longer than 3 months, but probably more closer to several years, have more memory concerns. And then as you get older, right, imagine being elderly, being on a sleeping pill, having to wake up to go to the restroom, feeling unbalanced, and then falling, right? So increased risk for falls is something that we also caution of.
Yeah. So even over the long run, I knew about trazodone increasing the risk of dementia, but even drugs like Ambien and Lunesta can increase the risk of.
Yeah, they pretty much all do. And, I don't think the research has parsed out, is it the medication itself or having insomnia? And I would say it's probably a little bit of both, right? If you're
Right.
undersleeping, and also, what are the medications doing to your brain that can increase your risk? Yeah.
So one of the things you mentioned is something called a sleep study. I'm not sure everybody knows like what is a sleep study and who needs it.
Good question. So I'm biased because I'm a sleep doctor. I think everybody should probably get a sleep study if you have difficulty sleeping. But typically what a sleep study looks for is a breathing concern. So one of the most common medical sleep conditions that I treat is obstructive sleep apnea. So what is obstructive sleep apnea? It's all in the name. It's a physical blockage of the upper airway. Generally, it's the tongue falling back, because at night when we sleep, all our muscles relax. And basically, we're choking ourselves when we sleep. And so sometimes we know this because we can wake up choking or gasping. Sometimes our bed partner will tell us that we stop breathing. And sometimes we don't know. And we can just wake up early in the morning feeling wide awake, unable to fall back asleep. Or not even that, just feeling tired, after lunch and really not sure why. So what a sleep study does, it monitors several parameters. There's home sleep apnea tests and also in-lab sleep studies. So the in-lab sleep study I'll start with is a very sophisticated test. We put EEG leads on your head, and so it's monitoring your brain waves, looking to see if you're awake or asleep, what stage of sleep you're in. There's a nasal cannula in your nose that's monitoring the air flowing in and out. That's a way that we can tell if you're breathing or holding your breath. There's a sensor for your chin, so we can see if you're grinding your teeth. Some people grind their teeth if they have sleep apnea, or sometimes it could be stress related or TMJ or jaw issue related. There's a belt around your chest to see if your lungs are moving up and down. There's sensors on your legs called EMG that see if your legs are kicking. And then there's a pulse oximeter, so we measure your oxygen and your heart rate. And there's also video monitoring, and then a sleep technician that watches you sleep. And so what we look for obstructive sleep apnea is if you're holding your breath for at least 10 seconds, 5 times an hour or greater. So 5 times is where researchers decided, okay, that's where we draw the line in the sand. And if you have difficulty breathing above that number, then that's diagnostic of obstructive sleep apnea. And it's broken down into mild, moderate, and severe. And so I think some of the reasons why women are underdiagnosed is because their symptoms are generally milder. Yeah. And sometimes, you don't actually have to snore to have obstructive sleep apnea. So that's something to keep in mind as well. And then there's home sleep apnea tests where technology is just so great now that you don't have to sleep in the lab anymore. You can sleep in the comfort of your own home. And it's the same thing, except we don't look at your brain waves. Some of the kits just have an actigraph. So it's like a medical grade Fitbit that will tell us if you're awake or asleep based on movement, the sensor in your nose that monitors whether or not you're breathing, and then a belt around your waist to see if your lungs moving up and down, and then the pulse oximeter. So really what we're looking for obstructive sleep apnea is your flow and then your oxygen levels.
And so it's interesting that one of the first things you said is you recommend everybody to do it. What about that person of, well, I just can't turn my brain off and I can't go to sleep, but once I fall asleep, I'm good. Would that person still be a candidate for,
Yeah, so
you
that's a
recommend
good distinction. Yeah, I would say probably not. So when we take a look at insomnia, we look at sleep onset. And so that's the case that you just mentioned, Dr. Brenner, is having a hard time falling asleep. So sleep apnea only happens when you're asleep. So if you have a hard time maintaining sleep maintenance insomnia, or you're waking up for unclear reasons, then that's typically from obstructive sleep apnea, if not another condition. Now, I do have patients who have a hard time falling asleep because they know when they are asleep, sometimes they dream that someone's choking them, or they have the nightmare that they're underwater and they can't breathe. So you're sort of parsing out, okay, so you can't sleep. Is it falling asleep or staying asleep? So people who have a hard time staying asleep, snore, gasp, choke, or feel tired, even waking up multiple times to urinate. I think that's something that we can talk about as well. Those are symptoms of obstructive sleep apnea. The falling asleep.
So even waking up many times to urinate is a symptom of sleep apnea?
Yeah, and that's something that's not often discussed.
I
I
learned something today. I never knew that.
Yes. So think about plumbing. All right, Dr. Brenner. So think about plumbing where you live. What happens if your pipes are blocked off? Downstream, there's more pressure. So relate that to your body. If there's a narrowing in the upper airway, then your lungs actually have to take bigger breaths, right? So there's, you have increased intrathoracic pressure, right? The lungs and the heart are within the same cavity. That pressure gets transmitted to the heart. The top part of the heart, the atria, actually stretches and signals down to your kidneys to tell you to wake up and urinate. Yeah, so oftentimes men, have this and they get put on a BPH medication for their prostate. But, what's going on in women? So if they're not diabetic, if they're not on a diuretic, a pill to make them urinate at night, could this potentially be obstructive sleep apnea cause, right? And so how do we treat it? Well, if you have obstructive sleep apnea, we open up the pipe. We use a machine called a CPAP machine, which is this positive airway pressure that keeps the airway open. And so once the airway's open, right, that signal from the lungs to your heart to your kidneys isn't there anymore. And you can actually stay asleep better. So something, to...
How many times would you consider waking up to use the restroom abnormal, or what is acceptable?
I'd say 2 and above is abnormal. Yeah. Mm-hmm. But I think something, a distinguishing question is, how do you urinate during the daytime? If you're, I'm sure you know the symptoms, right? The stress, incontinence, that's a little bit different than the nocturia. So.
Right. I also think, at least for me personally, is it really, because, everybody knows like, oh, I should drink more water and all that kind of thing and I try to do that too, but I try to get it done by like 3:00.
Oh, wow. In the afternoon.
Yes. And then really limit my fluid intake, like with dinner and after dinner. And that really makes a big difference for me.
Yeah. Yeah, no, I agree. But I think it's also interesting, right? Because research does show that people who don't have sleep apnea, right? Let's talk about insomnia, waking up and go to the bathroom. So like a question I like to ask is, well, do you wake up because your bladder's full and then you have to urinate? Or are you waking up and then since you're already awake, then you go to the bathroom? So I always like to rule out sleep apnea, and then actually treatment for insomnia with cognitive behavioral therapy has shown to decrease those awakenings to have to urinate.
Interesting. For people that aren't familiar with that term, what does that actually entail, cognitive behavioral therapy?
Yeah, cognitive behavioral therapy, good question. it's a multi approach. So there's cognitive behavioral therapy for a bunch of different type of conditions, anxiety, depression, PTSD, eating disorders. So one specifically for insomnia is includes sleep hygiene. So we learn, the habits that we should have in and around sleep. You learn about lifestyle factors. You learn about sleep science. So the biological processes that help control our sleep is discussed there. But I think one of the biggest part is the cognitive part. So the cognitive restructuring. So it's taking a look at the thoughts that you have in and around sleep. A lot of people that I speak to who have insomnia feel like they can't turn off their brain, that they've never been able to relax their mind. And so it's taking a look, the cognitive part is taking a look at those thoughts and actually questioning them and replacing them or transitioning them to thoughts that are actually more beneficial. So cognitive restructuring is really helpful for people who have insomnia. Sometimes patients have told me, I've never been a good sleeper. In my whole life, I've never been able to sleep well, even since I was a kid. And then we sort of take a look and, break that down. Is that really true? Well, how do you do on vacation, right? Or
Right.
how did you do before you started this stressful job or before your parents got sick? I'm sure you were sleeping, at least a couple hours a night. But sometimes it's really interesting at night. And I'm not sure why. And I think it's just because when it's dark and it's quiet, we've been trained that we should be asleep, and so if we're not asleep, there must be something wrong with me. And then we tend to catastrophize. And so all the scary thoughts come out when it's dark at night, and maybe just from watching scary movies as well. I have a good friend who's also a sleep doctor and a psychiatrist. In her culture, in the Indian culture, if you wake up between 2 to 4 a.m., 2 to 5 a.m., it's actually a sacred time. It's a sacred space where they don't catastrophize. They actually start meditating and doing their yogic breathing. So I think there's some cultural elements to this that are pretty interesting.
Interesting. Are there any other tests you recommend other than a sleep study?
For typically, no, in terms of tests for sleep apnea, I do screening questionnaires. So, if someone is not really interested in sleeping in lab or doing a home sleep study, there are screening tools such as like the Stop Bang, which is a questionnaire that looks for sleep apnea. For insomnia, I use something called the Insomnia Severity Index. But a lot of what I do, since I practice more integratively, is I like to give people the time and space to just talk. And then from there, together, we formulate a plan of care. What are your health goals? What's bothering you? And what's something that we can talk about? What are some tools and strategies we can start to develop to allow yourself to improve your sleep? I know that there's research looking into biomarkers, so blood tests that can look for sleep apnea and even insomnia, but they're definitely not mainstream yet or available to us. So.
What are your thoughts on alcohol? From my perspective, I see a lot of women specifically of, well, I just have a glass of wine or two to help me fall asleep.
Yeah, it's interesting. So I guess it's like from what perspective? From a sleep perspective, if you are going to drink alcohol, I would suggest to do it earlier in the day. I'm more of a recommender of a day drinker, maybe alcohol with brunch or lunch. And really the reason behind that is twofold. Alcohol has a lot of sugar. Sugar is not good for a lot of things, but it actually isn't good for sleep. We see from research studies there's more arousals. People wake up more frequently from a high simple carbohydrate sugar load at night. So a diet in high fiber actually promotes better sleep. And then the breakdown of alcohol, right? So we have actually pretty decent data that shows people who drink alcohol, and then we monitor them in the sleep lab. Alcohol makes you feel sleepy, but when it's broken down, it actually can disrupt the different stages of your sleep and actually wake you up. So if you are someone who's going to drink, probably closer to a happy hour situation rather than a nightcap and then go to bed.
Interesting. Yeah, I found that if I drink alcohol, I don't sleep good that night. And drinking wine is worse than vodka. So I wonder if it's because of the sugar content.
Yeah, there was a study that I did review not too long ago, and I think it is the sugar, with the grapes, and it's the clear alcohols that don't disrupt our sleep as much.
Oh.
So
So there's actually science behind. I told my husband that I'm like, I think I just do better if I have vodka.
Yeah, the research was like wine and then beer and then, like the clear liqueur as in terms
Interesting.
of, easier or more beneficial or better sleep. Yeah.
Well, while we're on the sugar topic, what are your thoughts about timing of eating before bed?
Yeah, that's such an interesting thing to talk about as well, because, you know, the way we live our lives now is almost like moment to moment, rushing and rushing. I have young kids, so we eat pretty early because we want to start the wind down process pretty early. But I mean, in some cultures, right, you don't eat until 9, 10 p.m. It is better to eat earlier, maybe 2 to 3 hours, right? You want your body to be able to digest the food. If you lie down too fast, I'm sure as you know, you can have more problems with heartburn, acid reflux, and you want your food to be able to digest, right? But also it depends on the type of food. So the timing of food is also important, but the type of food. Because, right, after a big Thanksgiving meal, you can feel really sluggish, right, from all the carbs that you've eaten. That's really, yeah, it can make you feel sleepy. But looking at what the research shows, the high carb load can actually disrupt the sleep architecture as well. So higher saturated fats and simple carbohydrates are something that you probably want to avoid at night. Yeah, so no more milk and cookies.
Yeah. For me, at least personally, I think it's it's kind of the Goldilocks syndrome is if I also go to bed hungry, there are times I'm like, I got to eat. Like I'm waking up because I'm hungry.
Yeah, and this is something that I think we are lacking in research. So I don't know how you feel about continuous glucose monitors, but
Oh,
they're
I'm a
very
huge
popular.
fan of those.
Okay, good. Yeah, they're very popular now, and I've seen through some, my friends on social media who are physicians talking, in their middle age, looking into, I'm waking up in the middle of the night and I'm not sure why, but then their glucose was dropping to the 60s and 70s. So, if you eat early, make sure you digest. It's probably okay to have a little snack before you go to bed. Maybe you, in fact, need it if your blood sugar drops. Because, right, these are the normal mechanisms in our body that are keeping us alive, right? You shouldn't have too low blood sugars. Our blood sugar should be at a certain level that sustains us, right? But we're also fasting. So it's really interesting now because intermittent fasting is so popular. I don't think we have enough data in around nighttime awakenings and blood sugar yet in the maybe non-diabetic population. So I hope that's something that
Yeah.
researchers are discussing. But I know people who do feel better after taking a snack at night or before bedtime and
Yeah.
then sleeping through.
Any advice for the shift workers? That's a population where I just feel like, I don't have any great solutions. And I mean, I look back of, I'm sure you can the same of when we did residency of when I worked the night shift for 2 months, like I just felt like the living dead the entire 2 months. Like,
Yeah, no, I know what you mean. Getting flashbacks now. Yeah, and we didn't have the work hour restrictions as
yeah,
they do now. So there are chronotypes. So there is a certain population who feel better, or night owls, feel better being awake at night. If you can link your chronotype to your career, to your schedule, then that's actually much better, right? So people who do night shift, if you feel most awake at night, then that's better. There's a good questionnaire for this. It's called the morningness eveningness questionnaire. Some people just choose to work at night, but their internal clock or their circadian rhythm does not allow for that. Meaning it's, probably how we were feeling really not well the next day from staying up all night. With that said, I think it's not good for our overall health, but we have 24-hour societies. So where should I start? I would suggest overall night shift workers sleep less. If you could anchor a time between when you're working and not working by 3 to 4 hours, which can be difficult if you have kids. So basically what I'm trying to say is tell your brain, have that set time so you know you're going to get sleep regardless when you're working or not working, overlap by 3 to 4 hours, then it can lessen the blow. If you can't do that because of kids, then make sure if you're sleeping during the daytime, You use blackout curtains, block as much light as possible, even when driving home from work. If it's sunny out, use the blue light blocking glasses to make sure that you're not getting that light, because light is stimulating and can wake you up. Melatonin may be helpful. Melatonin is really a heated topic because it's adulterated. There's quality concerns. But yeah, night shift is hard. If you are a night owl, then it's okay. If
Yeah.
not, then, get as much sleep as you can.
Is it best, I recently saw a patient who was an ER physician, and is it best to always stay on night shift and kind of shift of this is when I typically am awake, this is when I typically sleep, or when you're not working, go back to being awake during the day and sleeping at night?
Yeah, and I would say it depends on how often you're flipping back and forth. So just imagine, like, I know some people do every other week. That's probably easier than every 2 to 3 days, going from night to days. And it's like traveling, right? You're traveling between, where we are to Europe, and then 2 days we're traveling back, and your body is just quite confused. So if you can do longer stretches of nights and then flip back to days, that's probably more beneficial than flipping back and forth every 2 to 3 days.
Sure. I agree. And last but not least is you mentioned melatonin. I'll just kind of make it a little bit more broader about, the whole supplement industry is you walk into any grocery store, online. I'm not sure if you do supplements in your office, but a lot of people like to self-treat. There's been some recent controversy about melatonin of maybe if you can comment on melatonin, CBD, or even people taking THC or gummies, magnesium, any of those kind of things that people can get their hands on without seeing a physician.
Yeah, good question. And yes, so we can start with melatonin. In 2017, there was a big research article that basically discussed we don't know what you're getting in the bottle. There are some reputable brands. You can check out Consumer Labs. It's basically like a third party that reviews the quality of different supplements. And do you in fact need it, right? So from a sleep medicine perspective, we use melatonin for shift work, jet lag, and then a condition called REM behavior disorder. There is research that shows as a woman gets older, right, as people get older, age 55 and above, our pineal gland, where melatonin is made and released, we may have lower levels of melatonin. And then specifically, a study talked about women who used 3 milligrams of melatonin for 3 months during menopause reported better quality sleep. And this was subjective reports. So there probably is something to it, but make sure the melatonin that you're using is high quality, and how much is enough melatonin. So if you take a look at how much our brain actually gives us, it's 0.3. And, I've seen like 3 milligrams, 6 milligrams, 10 milligrams. I think I've even heard of patients taking up to 50 milligrams or greater. So melatonin isn't without side effects. Hangover type effect, increased dreams, low blood pressure, I've seen in some patients, nausea, vomiting. But I'd say with that said, it's generally well tolerated.
Mm-hmm.
It's just, are you just spending a lot of money on it? Yeah, so that's one thing. CBD, THC, very interesting. It's a plant. And so with plants, I had a friend who gave a lecture about CBD for sleep. And, the way he described it, it's like grapes, right? So, the environment matters. The soil matters, right? The temperature matters. And in US, right, there are states that have decriminalized it, but federally, it's still, what is it? A class 1 scheduled, medication, a drug of abuse. So I think that limits the amount of research we can do on it. With that said, sleep happens when your brainwaves slow down and you relax. There is research that shows a higher ratio of CBD to THC is helpful. Some people think of THC as more the psychoactive component. So a ratio of 60 to 1 CBD to THC, or even up to 30 to 1 can be helpful. And the thing about cannabis is that it's got something called the entourage effect. So is it just the CBD? Is it just the THC? Or are there other components within the plant that are beneficial for us? CBN is something that's promising to help us sleep as well. So I think it's one of those things. I know it's pretty expensive. I would suggest, what's the end game here, right? Are you going to be dependent on something that costs you $100 a month?
Right.
Or can we look for, maybe it's untreated sleep apnea, or maybe, working on your stress is something that's more beneficial. Magnesium, I do like to recommend magnesium a lot. The reason there's a couple fold, it works on GABA. So the GABA system is actually, sleep promoting. It's the same system that the Z drugs work on, the benzodiazepines and the Ambien and Lunesta. Magnesium also can help relax the muscles. We use it in pregnancy, right, for blood pressure. The thing about magnesium is that there's different forms, and sometimes it can cause diarrhea. So people who have more like musculoskeletal issues, maybe like restless legs or like muscle aches and pains, and I like to recommend magnesium. And it's pretty readily available, but just caution on the type that you're using because it can cause diarrhea. I also like to discuss lavender, oral lavender, or even diffusing lavender as aromatherapy. That can be helpful for sleep. Lavender actually has been shown in some research where we've took nursing home patients who were on sleeping pills, on benzos, and lavender helps reduce those withdrawal symptoms. Yeah, so that's actually something. And we haven't seen any of the safety problems with it, side effects, like we do with the sleeping pills. And there's also passion flower, hops, lemon balm. So yeah, a lot of different herbs that are probably beneficial. But as a whole, what I like to recommend to patients, or the discussion is sometimes your brain is just so powerful. It can overcome the chemical effects of these substances you're taking. So it goes, to take a step back, why are you really having a hard time sleeping, right? Mm-hmm. Is it those ruminating thoughts? So I think the whole cognitive restructuring, since I practice integratively, I also like to bring in mindfulness to the mix. And, how can we learn how to train our brain to be calm and relaxed so it's easier for us to fall asleep rather than, us paying a lot of money on things that may or may not work.
Right. So what is the process when people see you as patients? I know you mentioned you do telemedicine. Is that just for California and Hawaii residents? And what's the process and how can people find you?
Yeah, thank you so much, Dr. Brenner. Yeah, so I am a licensed and I malpractice in California and Hawaii. So my medical practice is available to residents of those states. They can find me on my website, which is Sleep Life Med. I got my office, and I have an intake. So I like to ask patients a lot of questions about their sleep. So I like to say, the more I know about you, the better I can help. If they need a sleep study, then we go with that. If they're more insomnia, then I have individualized classes. So I am trained in cognitive behavioral therapy. I like to bring in mindfulness approaches. We talk about supplements if that's something that they're interested in. And then I also provide clinical hypnotherapy. So that's my medical practice. And so outside of that, I've been developing a women's sleep program, an educational program with coaching and courses called Sleephoria. And that's for people who aren't in those states, right? 40 to 60% of women during perimenopause and menopause have difficulty sleeping. So I think that's a lot of women out there. And there's a lot of information that I think I can get to them to help them improve their sleep. So those are two ways that they can find me depending on where they live.
Well, thank you. This was so helpful. I myself learned a lot, and I can't imagine that this wouldn't be beneficial to really any woman in their late 30s on up. So thank you so much for this great information.
My pleasure, Dr. Brenner. Thanks for having me on. I had a great time as well.
Thank you for listening to this episode of HealthiHer. You can find us on Instagram, Facebook, and the web. Go to www.dramybrenner.com to learn more. This podcast is for general information only and does not constitute as medical advice, the practice of medicine, nursing, or other healthcare services. No patient-physician relationship is formed. The information in the podcast and any references, material, or links are at the sole discretion of the listener and not meant to be a substitute for professional medical advice, diagnosis, or treatment. Listeners should not delay or disregard obtaining medical advice for any medical issues or diagnoses that they may have, and should seek medical advice from their healthcare provider for any such condition.